Good morning. I'm Dr. Gray Erlacher, and welcome to Start Your Day with Dr. Gray on the morning show. And I do have a special guest today. You're going to want to stick around and hear this because we're going to talk about weight loss and obesity. And obesity and overweight is a serious problem. There's medical concerns with that. It increases your risk for diabetes and heart disease and sleep apnea and many other things. We're going to get into that a little bit. But today we have a special guest, Dr. Rana Marzouq from Boyce Willis Clinic, and she is double board certified internal medicine and obesity, and about as close to an expert as we can get. And it's a big deal here. I looked it up. In Nash County, Edgecombe County, we have a very high rate of overweight and obesity, about 40% obesity rate, higher than the state average, and our state is higher than the national average. So this is a serious problem. It's definitely a medical problem. It's not just simply a cosmetic thing. So losing weight is not just about looking good at the swimming pool. It's about your long-term health and well-being, and I think that's one of the focuses of Dr. Marzouq, is not just losing weight, but it's actually improving your health and your quality of life, and not just living long, but living well. So we're going to talk about that today. So this is Dr. Rana Marzouq. Good morning.
Good morning, and thank you so much for having me here. I am very excited to discuss weight loss today, mainly GLP. As for the past few years, GLP have changed the way we approach and treat obesity. So it has been very exciting with a great outcome.
Yeah, that has been a game changer, hasn't it?
It has been, yes.
So she mentions GLP-1s, and that includes, let's see, Ozempic was kind of the big one. Everybody talks about Ozempic, right?
Yes, so GLP can include Ozempic, Wegovy, Zepbound, Mounjaro, but the FDA approved GLP for weight loss will be Wegovy and Zepbound. Ozempic and Mounjaro are FDA approved for the treatment of diabetes.
Right. So really kind of when this broke out a few years ago, Ozempic was really a diabetes drug, right?
Yes, and still a diabetes drug.
And it's still a diabetes drug.
That's right.
And I noticed that they have an oral version, which was Rybelsus.
Yes.
But now they're renaming it Ozempic.
That's right.
So it's the same drug, but it's available as a shot and as a tablet.
That's right.
That's right?
Yes.
And so those are what they call GLP-1s.
Yes.
Right. And, okay, I'm not going to put you on the spot, I promise you, but so how do they work? What do they do?
So GLP, let's begin by understand what's GLP. GLP stands for glucagon-like peptide 1, which is the natural hormone that your gut release in response to meals. So taking something like Wegovy or Zepbound will enhance the signaling pathway of GLP, where it regulates sugar, blood glucose, make the patient feel fuller, decrease stomach emptying, and it sends signal to the brain where it reduces hunger and craving, which will lead to weight loss.
I see. So patients are less hungry.
Yes.
Because they feel full quicker, they have less hunger sensations, I guess.
Yes, GLP, I think about it as a communications pathway in the gut. So basically, it signals the pancreas to release insulin in response to elevated glucose level. Then it sends the signal to the hypothalamus, which is the structure within the brain that tells the patient, okay, I'm full, I'm not hungry, and it reduces craving.
So it's kind of telling your brain, hey, you don't really need that second banana split.
That's right.
You could say, okay. But doesn't it also work metabolically, where it's not just an appetite suppressant, right?
Yes. So it's very exciting to know that Wegovy has an indication for fatty liver. So for a known mechanism, we know that Wegovy is indicated for the treatment of fatty liver or prevent the progression of that. So what was thought to be that GLP reduced the inflammation, perhaps reduced the fat within the liver, and therefore that is one of the great indication for that. Also, Wegovy is indicated for coronary artery disease. That was another exciting, evolving indication for the Wegovy.
Go back a second. It decreases inflammation in fatty liver disease?
Yes,
Really?
which we're hoping it will reduce the progression of fatty liver. And that was very exciting to have that type of indication.
Yeah.
So GLP not only indicated for weight loss, but as you mentioned, it has a great metabolic effect.
So that's interesting. So really, a lot of these things are related, aren't they? Coronary artery disease, stroke, fatty liver, diabetes, they're all metabolic disorders, right?
Yes.
And so, so I'm guessing that, well, okay, I know the answer, sort of, because I have a doctorate, but for the purpose of the interview, so GLP-1s, what else do you see? They don't just lose weight. I mean, their numbers improve, right?
Yeah, so when we approach obesity is chronic medical conditions. It's a complex medical conditions, mainly influenced by genetic, hormones, medications, environment. So when you take therapy that not only improve the number on the scale, but also improve the patient health across different organ systems, that is great. So as the patient lose weight, they are getting healthier. It's not only about losing weight, it's about losing it the healthy way.
Yes, for long term.
For long term and maintain the weight.
And so patients that are on a GLP-1, they have less incidence of heart attack, less stroke, and other benefits like that as an aside.
Yes, in the clinical trial, that's what was found.
Yeah.
That it does reduce the progression of chronic kidney disease, mainly when we speak about Ozempic, which is a diabetes medication. Then when we speak about Wegovy, it decreased the progression or possibly reverse the progression of fatty liver, and it protects the heart.
Yeah. Oh, that's fantastic. And so, okay, let's take a hypothetical patient, like someone here in our audience. And by the way, back when I said 40%, that's 40% obesity. If you count overweight, it's like over 70% in our viewing area. So this is something that a good bit of our audience needs to hear, I suppose. So let's take a typical patient or an average patient. Let's say it's a 50-year-old woman. And she's been to the doctor, she knows she needs to lose some weight for her health and wants to, just for her overall health, needs to lose about 30 pounds. She's been told she's got pre-diabetes. So that means her A1C is a little bit elevated, let's say 6.2% A1C. That's a good number to know, by the way. Her A1C is 6.2%. She's got about 30 pounds to lose, and she's so busy. She's got family, she's got a job. She says, I hardly eat, but she doesn't have a whole lot of time to be cooking and going to the gym and all of that. So this patient presents to you with that concern. She wants to lose weight. How do you approach that? What kind of questions are you going to ask or tests you might do?
So I begin by conduct a detailed, thorough medical history. That is very important to see if she fits to be treated for GLP. GLP could not be for everyone. So it's important to really take a moment to look at the patient history, the medication that she's taking, supplements, stress level, sleep habit, eating habit, exercise, if any. So that will be the first thing that I will do to approach the patient, just a good, history taking. Then, as we may know, obesity has a multifactorial It could be secondary to tons of medical conditions. So it's very important to find out the underlying cause of obesity. So I would like to order lab work for the patient. I usually look for conditions that can induce weight gain or perhaps make patients struggle to lose weight. For example, thyroid disease, iron deficiency anemia, B12, diabetes, hypertension, hyperlipidemia, sleep apnea. So once we find out the underlying cause, then I will evaluate the patient further to see if she's a candidate for GLP. GLP is great therapy, but it may not be for everyone. So there is contraindication. So patients who have a personal or family history of medullary thyroid cancer or a syndrome called MEN2, which stands for multiple endocrine neoplasia type 2, are not a candidate for GLP. So that's why it's important to take a minute to really understand the history here. Also in terms of patients don't have time to cook, don't have time to exercise. I totally understand that. Many of my patients have the same issue, and that's basically the reality for a lot of patients. Lifestyle is very busy, but I tell patients it doesn't have to be a perfect exercise or the perfect meal. So for example, when it comes to exercise, walking around the block 10 to 15 minutes a day, having resistance exercise where you work out your muscle 1 to 2 hours a week is sufficient enough to help with weight loss. I tell my patient, do not wait for the perfect Monday to sign up at the YMCA. So small little changes are more powerful than trying to be perfect for a week and quit.
Yeah, that's true. That's true. It's better to make small gains along the way.
Yep.
And you mentioned, I think, thyroid cancer, multiple endocrine neoplasia as the contraindications, but those things are pretty rare, aren't they?
They are very rare.
In fact, I don't think I've seen anybody in the last 10 years that would not qualify for that reason.
I have not seen anyone either
it's
with
pretty
that
rare,
indications.
But they're required to say, don't take this drug if you have those. But those are very rare.
Very
Neither
rare.
of us apparently have seen one in a long time. And so let's say, and I love it because that is important. The first thing, you want to get a good history. If you go to one of these little shady clinics, they may not ask you about sleep, or if you're ordering it online, say. And I think those things are important. What's your activity like? Are you sleeping well? Are you stressed out? I think those things are important. So it's great that you do that. So let's say they have, they've gone through the workup. Now we know their blood sugars are running a little high, their A1C is a little bit high, their cholesterol is a little bit high, and that you've determined they're a good candidate for a GLP-1. So where do you go from there? You just prescribe it and demonstrate it and follow up?
So I tell my patient GLP-1 alone may not do it. Patient must incorporate a good nutrition and exercise in augmentation with GLP for a great outcome. So patient will lose weight on the GLP but may not sustain it for a long term if there is no sustainable nutrition, sustainable exercise. So when I decide to prescribe GLP-1 for my patient, I also give them a good information about, okay, so this is how we're going to do your diet moving forward. You try to stick with it as much as you can. Again, it doesn't have to be perfect. So generally speaking, a good bulk of protein intake daily is essential to keep to preserve muscle mass. As patients lose weight, they lose fat, they lose mass, and we really want to preserve the body composition. So close to 90 to 100 grams of protein daily is essential to lose weight the healthy way and to keep it. So So proteins, hydration, and close follow-up. GLP may require titration of the dose, and that's where close follow-up in a monthly basis to see how the patient doing, how much weight he or she lost will be essential to see if the patient needs to titrate up or down the dose.
So you feel that 90 to 100 grams of protein a day?
So generally speaking, yeah, for most people, protein intake vary with age and BMI. So I would say between 1.1 to 1.5 gram of protein per 1 kilogram of ideal body weight should be good.
Okay. So 100 kilograms would be a person who's about 170 pounds or something like that. So if they're, say they're in that range, they need, so 100 grams, so to hit 100 grams of protein, that's like 3 or 4 eggs in the morning, chicken breast at lunch.
Yep, so the
food, I'm thinking of things that are high in protein, meats, eggs, fish.
Yes, and also let's say patient have high cholesterol and said, I need to stay away from eggs. So I usually say protein shake will do it. Ensure has 30 grams of proteins in it. So if patient want to reserve, to avoid eating eggs or chicken or, certain food that is great in protein but also high in cholesterol, I will just say, try to, grab a few Ensures a day, 30 grams each. If you drink 2, that's 60 grams of protein to start with is
like you mean the Ensure cans?
That's right.
And they have about 30 grams in them?
Yep.
Wow, okay, that's great. And what about side effects of the medication? That seems to be kind of a limiting thing.
Just like with any medication, GLP have GI side effect. Patient may or may not experience nausea, constipation, diarrhea, abdominal pain, headache. The side effects are tolerable and mild, and it does improve with time.
Yeah, I think that's why they kind of work the dose up as they go.
Yes.
Right? They start with a low dose, and then each month you go up until you're getting weight loss but avoiding side effects.
Yes.
Do you use Zofran for the nausea?
As needed. But I tell patient, the nausea, if you were to develop nausea, it's usually when you start taking the medication.
The very beginning.
At the very beginning, it wears off, and then possibly every time we titrate up the dose, there might be a chance of patient, getting nauseous. We definitely can give prescription for Zofran if needed.
Okay. And we just have a minute left. And another big question or debate you hear is, once I start a GLP-1, can I quit? Is this for life? Am I always going to be on this drug?
Every patient is different, and that is basically individualized. For example, certain patients may have to stay on the GLP for long term, where others may be able to titrate down the dose or potentially stop the injections once the weight loss is achieved. I tell patients, as you are taking the GLP therapy, please have a sustainable nutrition, sustainable exercise. Let's try to reverse the factor that may have influence obesity. For example, you want to have a good sleep hygiene. If these factors if most of the factors that influence obesity have been reversed and patients able to sustain a good nutrition and exercise, GLP-1 can be weaned off and possibly stop.
That's great. That's great. Yeah, I think that's key. You can't just quit what got you there. You have to still be very conscious about your diet, your exercise, your sleep, all of those things. Correct?
And that's why close follow-up is very important and essential for the patient and their safety when they take GLP.
Okay, fantastic. Well, that's Dr. Rana Marzouq, excuse me, and she's at Boyce Willis Clinic if you'd like to see her. And I'm Dr. Erlacher. If you'd like further information, if you have more questions, you can visit our website, erlacher.com. urlachermedical.com. And there's a form that pops up when you visit the website. So if you have questions about a previous show, for example, we did a show on dementia. If you'd like a list of things you can do to help prevent dementia, contact me through the website, urlachermedical.com. Thank you, Dr. Marzouq, and thank you for joining Start Your Day with Dr. Gray. I'll see you here in 2 weeks, Thursday mornings at 7:20 on WIG TV. Thank you very much.
Thank you.